freshmen at IU when the pill went onto the market. You can imagine word of that innovation spread like wildfire on campus and throughout the country. Because knowing that we had some control over our bodies was a very liberating experience. Then 12 years later, the Roe v. Wade decision came down, and that gave women a backup option to make our own reproductive health decisions. Well, as you know, we've now lost Roe v. Wade, and Indiana's Republican supermajority jumped to become the first state in the country to outlaw legal abortion. These losses make access to highly effective contraceptives even more important in our state. That's why I offered HB 1420, the 12-month contraception bill. What it does, it requires insurance companies, the state employee health plan, and HMOs to provide 12-month coverage without cost sharing for all FDA-approved contraceptives and services. It also requires coverage for counseling, screening, and treatment for sexually transmitted infections and medications to protect HIV-negative individuals from HIV if they are exposed through sex or intravenous drug use. And finally, it also requires coverage for human papillomavirus vaccination for prevention of cervical cancer. By the way, Indiana's HPV vaccination rate is only 41%. The national rate is 50%. And even that isn't great. Especially when you know that 9 out of 10 cervical cancer cases in the U.S. are caused by the human papillomavirus. So I digress. Back to my bill. This was the first time that a 12-month contraceptives bill was authored in Indiana. Unfortunately, it wasn't given a hearing in the insurance committee where it was assigned. However, I'm not giving up. I worked for Planned Parenthood for 17 years, and that gave me an even greater appreciation of how important access to contraception is. One example that stands out in my mind was the year of the blizzard that hit Indiana. It shut down everything in Muncie. The roads were closed, the grocery stores, the pharmacies, the Planned Parenthood. Well, after the roads were cleared and Planned Parenthood opened, the staff found a note on the door from a couple who had run out of their contraceptive pills and walked to the clinic to get another pack of pills and found the door locked. Imagine if they could have had a 12-month supply in their medicine cabinet, they wouldn't have had to make that futile trip. And of course, we've all heard of pharmacy deserts. Women who live in those areas would benefit from HB 1420. In fact, anyone of childbearing age who wants to avoid unintentionally becoming pregnant would benefit from HB 1420. The 12-month contraception coverage is not a new idea. 21 states and the District of Columbia already provide for it. So next year, Let's make Indiana state number 22. Thank you. Hello, everybody. I come to the conclusion y'all really can't hear me. Y'all can just read my lips. I'm glad to be here. Am I supposed to talk about something?
11:25.
Yeah, I'm trying to figure out what that is.
Maternal health?
Yeah. Health bill that did not get a hearing. What we want to do in the state of Indiana is to make things better for birthing persons. And it's not going very well. We know that maternal mortality in the state of Indiana touches 117 per 100,000 women die, just by being pregnant and having a baby. That has to stop in Indiana. And yeah, those are the statistics. Now, it used to, when I first started talking about maternal health and created a maternal health caucus a couple years ago to make it important for the legislators to know, it was 55 per 100,000. That was 2 years ago. Now it is 117 per 100,000 women that die just by being pregnant. And I mean, the numbers are, well, actually, that's 117 per 100,000 for African American women. It's like 55 per 100,000 for Caucasian women, and they really don't have the numbers on the Hispanic population. So what's happening is we are losing women, and we're leaving a lot of children without the love of a mother. And I think that we should be able to do something about that.
Yes.
I'm going back to session.
Good luck.
Thank you everyone for being here today. My name is Maureen Bauer. I'm a state representative in South Bend, Indiana. This winter, I joined one of my Republican colleagues in the House, who's a legislator from Goshen, Indiana, to convene a roundtable discussion between doulas and midwives with the goal of formulating policy that we can introduce together to support infant and maternal health. Based on those discussions, I authored House Bill 1028, a bill to allow Medicaid reimbursement for pregnancy services provided by a midwife. I was contacted by a woman in DeKalb County who shared with me that 3 rural hospitals had closed their doors in northern Indiana, forcing families to drive to the next county just to receive care. Providers in that area expressed that they want to continue serving their community instead of moving to another area to provide care and find work. They need our support as policymakers to open thriving birth centers by providing Medicaid reimbursement to allow them to do just that. Locally, my county, St. Joseph County, their health department conducts a birth equity assessment every year. And they concluded that expanding options for birth was one of their recommendations. All of us here are aware of our dismal maternal and infant mortality rates. Policymakers in the state know these rates that Representative Summers mentioned. It's imperative that we act now to save lives, strengthen families, and support moms and babies in our state. With a third of our state being OB and hospital deserts, you're increasing your risk of pregnancy complications, putting up barriers to access health care in a state that didn't even see fit to provide pregnancy accommodations for working pregnant women. I'll continue working to represent the best interests of pregnant people to ensure we are expanding birth options in our state to help moms and babies thrive. Thank you all for being here today.
Welcome, Planned Parenthood activists, advocates, supporters. Thank you for being here. I just wanted to say that Hallie how we are a group of passionate advocates. But I'm also angry. I'm an angry advocate and activist and legislator. What we are seeing around this country is no different than what we can expect here in Indiana. We have to remain alert. I filed Senate Bill 208 to return us to where we were before we banned access to abortion care in the state of Indiana. There is a hurdle that, as a member of the minority party, we have to overcome in order to get a bill heard. That hurdle is we have to have a colleague on the other side of the aisle to join us and be a second author on a bill. Senate Bill 208 overcame that hurdle, and I am joined on Senate Bill 208 with Senator Anita Becker. This is a testament that issues of access to abortion care are not partisan. This is a stance and a message to every single Hoosier in this state that we see you, we hear you, we are fighting for you, because access to abortion care impacts every Hoosier. Woo! The bills I have listed that did not receive a hearing and are now dead speaks to the lives that we are not listening to and risk being dead if we do not respond and provide full access to abortion health care in this state.
Truth, truth, truth.
What Representative Summers was speaking to, we are only going to see those numbers increasing in the state of Indiana.
Unacceptable!
It is unacceptable. So thank you for being here. We are not going to turn our backs on Hoosiers, and we're going to continue to fight for full access to the health care that every single Hoosier in this state deserves.
Yes.
Thank you for being here. Our work is just beginning. Thank you.
Hoosier, a longtime leadership educator with over a decade of experience in teaching people how exactly positive change occurs in community, and that includes Indiana. So I'm also proudly here as a policy director for a crew called the Indiana Task Force, and we are absolutely and reimagining civic engagement. So in regards to that organizing, right, and how we do it, we've always used the same framework called reproductive justice, and because of that, we believe that it's important, one, right, that we make autonomous decisions about what our families look like, and so many of these bills have really addressed that powerfully. If only they would get a reading, right? But we also believe that it's equally imperative that we all have the opportunity to build those families in safe, sustainable communities with healthy environments, free from violence, whether it's from the state or from other individuals, and free from oppression. We all deserve to know that we're giving our families a real shot at survival, and that needs to be true according to Indiana Task Force and according to all of us, right? That needs to be true whether we were born in Hammond or in Carmel. That needs to be true no matter what uniform we wear to work, whether we're rocking steel-toed boots or we're wearing a blazer, or maybe we're both, right? But because we get on door, we're organizers after all, we're meeting people in our communities, we're talking to our neighbors, we know that that framework is actually what speaks to Hoosier families who are worried about putting food on the table, which by the way is about 1 in 8 Hoosier families. It speaks to Hoosiers who are looking for comprehensive sex education so that they can remain safe. And so if you've supported legislation to protect those families, we want to thank you. And why, though, are we reimagining civic engagement? We do that because traditional approaches, like calling many of our Republican and Democratic legislators alike, urging them to take our survival seriously, has not been enough. We as an organization make thousands of calls each year to tell our stories about cruel landlords, about the cost of life-affirming care, about our need for doula services, and still the unthinkable occurs. Thus, we are organizing to make certain forms of harm unthinkable. Unthinkable to block queer youth from feeling safe at home and at school. Unthinkable to prevent low-income people from voting in our state. Unthinkable that the mortality rate for Black women and Black parenting folks is almost 3 times the rate of other pregnant people, especially when Indiana has the 3rd highest, it bears repeating, the 3rd highest maternal mortality rate in the country. No one should have to suffer these indignities and threats to their life. And if you've supported legislation to put a stop to these human rights issues, these solidly reproductive justice issues, we want to say thank you. So what do we do when other politicians and when local leaders fail us? We center and we protect those who are the most at risk. We leverage resources for our collective thriving. We share power. We share stories. We grow our understanding of the political process, and we put these leaders on notice. So if you've ever gotten a Valentine from us during session, that's just a reminder that we are paying attention. We are. And you may have noticed that the umbrella of things that we care about is really big, right? We've talked about a lot of things, and that's by design, because Indiana Task Force and our legislators and all of the organizations present here today, we have to stand for all Hoosiers. For all Hoosiers. That's right. We're all vulnerable in different ways when our ability to make decisions for ourselves is taken away. We can't stand around and wait to be heard, so today, instead of telling you my story, I want to urge these folks here to pull forward theirs. So think about a time that you personally pushed, for a piece of legislation, a time you felt personally pushed to do that, a time you felt an embodied understanding of a problem, because that's what every single one of our members have. An embodied understanding. We read every piece of proposed legislation every single year because bad bills like HB 1264, SB 17, they can't be done in the dark, right? And as an educator, I will tell you that some of the best leadership across time has always been done by marginalized people to ensure their survival, right?
That's true.
So I ask you this year, whose survival will you stand up for next session? Indiana Task Force thanks you in advance, and we will see you next Valentine's Day, and again, and again, and again, until we build the Indiana that we all deserve.
Woohoo!
So thank you for your time. I'm lucky to call forth a longtime collaborator of ours. We're going to bring forward Jess Louise from the incredible All Options.
Hey y'all.
Hello.
I just want to start off by lifting up the name of a trans indigenous student who was killed because of a failure for legislators to act on their behalf. Next Benedict, we speak your name today, and we hope that justice is found. Whew. So we're gathered here today as individuals under the banner of justice to loudly proclaim that our rights matter. And they do. Consider, though, how we arrived to this moment in Hoosier history. The political parties gathered in the building and rooms in the background didn't wake up suddenly from their book clubs, employee resource groups, or mission trips to insist that we be stripped of our ability to choose what's best and right for our bodies. The act of organized legislative violence against us is malicious, intentional, and diabolical. I implore you now, as June Jordan has before, we must decide to become a menace to... My glasses are not working today. We must decide to become a menace to the enemy among us. Though that enemy may have faces and names today, it is the enemy that hands down systemic oppression, that enemy dressed in a black robe or a white sheet with a gavel or a noose, who must be held accountable to the very people attempting to navigate the fatal, choppy waters of white supremacy and white nationalism.
Truth.
We must take action. For some, taking action has meant participating in activism, making signs, running up email blasts and phone zaps, amplifying rallies and demonstrations, joining together with thousands of others to push past the niceties that Hoosier hospitality presses into our bones to tell whoever will listen that we are willing to pound the pavement and exhaust ourselves by becoming a menace to the enemy of reproductive freedom. For all options, that action has meant showing up every day, committed to the heartbreak and heart song that comes with navigating reproductive choices. We welcome Hoosiers with the space you need and desire, with judgment-free listening and unbiased resources so that you can arrive to what's best for you. Our Hoosier Abortion Fund helps people find and pay for abortion care, and our Hoosier Diaper Program provides diapers for families struggling to make ends meet. And it shouldn't surprise you that these are some of the same people. More than half of people having abortions already have children, and no one should go broke trying to take care of themselves and their families. That's why we'll keep being here for Hoosiers no matter what. Whatever you do, you must continue to take action. Not just this day, but every day forward. Hoosier hospitality has turned its back on the sanctity of our individual and collective reproductive choices. So until and unless we fall with our full selves into the commitment of the tenets of reproductive justice, the right to abortion will continue to be snatched from our grasp at the hands of legislators. I commit to organize to become a menace to the enemy of not just abortion rights, but also reproductive justice. I commit to lifting up the incarcerated, trans, non-binary, queer, disabled, undocumented, Black, brown, and indigenous folks who will feel the depths of these laws and their restrictions first and with disproportionate harm. I commit to freedom. I hope you'll join all options and everyone here as we all fall forward in the fight for freedom with these truths and actions. Commit with us.
Hi everybody. First I want to thank you. I see so many people that I recognize today, and it is always so amazing to be with you in these spaces. My name is Chelsea McDonald. I am with the Mad Voters organization. We are a social advocacy organization committed to educating and supporting all Hoosiers with understanding legislation and the election process. We are at a crossroads in Indiana. I hate standing up here and saying this, but we hear often, look at Oklahoma, look at Texas, look at Alabama. We are in a battle for our bodies, for our rights, and for our lives. It is not an overstatement to say that the state of Indiana is in a state of emergency, and we are the first responders. You, me, as voters, we have the power to turn things around. Yes, it will be hard, and yes, it will take time, but for our children, our families, our communities, and ourselves, we will fight this. Take, for example, Senate Bill 128, a Senate bill that could effectively ban the mention of LGBTQ people in all public schools, and it could restrict sex education even more. Or House Bill 1291, a bill that drew widespread condemnation and subsequently failed to move forward in the legislative process. That bill would have erased any mention of trans individuals in our legal statutes, denying them legal recognition. Thankfully, that bill hasn't moved forward, but we must keep our guard up. The fact that it was filed as a bill shows that there are some legislators who are willing to take this extreme step of denying legal status to our fellow citizens. So what can we, the first responders of a democracy, do? We can support grassroots candidates running to challenge the status quo and the supermajority. I am thrilled to say that the amount of uncontested seats has decreased by 15% this year. That is huge in Indiana, and it needs to be noticed. And that's progress. I'm asking you to support these candidates. Ordinary folks like you and me, they don't have the corporate interests or their dollars, but they have a passion for making Indiana a better place. Show up for them on the campaign trail, show up for them on primary day on May 5th, and show up for them in the general election on November 5th. And we can keep talking about the importance of taking back our freedom and our rights. Earlier I mentioned that we have to focus on Indiana, but I would be remiss if I didn't mention Next Benedict, a young non-binary student from Oklahoma who died after being beaten in a public school bathroom. This story is heartbreaking, but I need you to understand that this can happen in Indiana. We have heard the tragic stories over and over and over. Children not being able to live as themselves anymore because they are denied every opportunity to be exactly who they are. This can happen here. It will, it has, and we have to stop it. We must challenge those in the legislature when they say Indiana is a pro-life state. Really? Show us. Show us how you will protect kids like Nex. Make contraception more accessible. Ensure that every student has access to comprehensive, scientifically accurate sex education. Empower people to make their own medical choices. Improve wages. Do something to reduce the terrible levels of pollution in our state. Curb the gun violence. Show us what it really truly means to be a pro-life state, because this isn't it. Not when Hoosier mothers and infants have the third highest maternal mortality rate. Now when our students are suffering mental health crisis and the only solution provided by this legislator is to insert unlicensed religious chaplains into the role of school counselors, we are not pro-life. So thank you so much for being here. Please, please show up. Keep fighting. There are a lot of people standing next to you. You are not alone. Thank you. Amazing establishment, and they truly support and believe in democracy. So I am so thankful you're here.
Hi everybody, thank you for being here, all the lawmakers, the organizers, the speakers, the supporters. It's going to take all of us in this battle. I can't speak as a healthcare provider or a lawmaker, but I can speak as a woman, a mother, and a business owner who has contributed millions in tax revenue to the state of Indiana in my 23 years of doing business here. I started my journey of outspoken support for Planned Parenthood and reproductive rights on Inauguration Day 2017, when I felt small and scared of the promise to overturn Roe v. Wade. I needed something I could do to show that I would not only continue to support Planned Parenthood, but I would loudly and boldly show that support as a business owner. In the years since, I've worked to encourage more business owners to join me in publicly sharing their support for reproductive rights in Indiana, rights that include protecting access to safe and legal abortion for all. Whether or not I agree with it, the power of business in politics is real, and I'm only one voice. But together with the ACLU, we've been able to put together over 900 voices of business owners across the state of Indiana in support of reproductive freedom. Indiana businesses are already standing up. Every Indiana business has the opportunity to add their business to that list. The opportunity is to stand up for people and their choice and their ability to access quality, safe, legal reproductive care. Women are a vital part of our economy, of every economy. And it's a fact that when women have access to all aspects of reproductive care, not only do their own outcomes in health, education, and employment improve, it trickles down to their children, improving their own health, education, and employment outcomes. And that, in turn, builds a stronger community and economy. If Indiana employers believe in the value of women in the workplace, the value of uplifting women in their community, then they need to stand up in support of access to reproductive health care, including birth control and abortion.
Yes.
I would love to see more of these corporate champions of women add their support to the legislation that ensures this access to reproductive care, the access that we desperately want and need. If you're in a workplace that has initiatives to support women, ask them, if they already or if they will also support the legislation ensuring that women have a right to those reproductive health care choices. If Indiana lawmakers believe in the value of women in Indiana communities, then they need to be promoting and supporting the legislation that allows women to make these choices for themselves. It's been a long 7 years since that first public step I took, and now is not the time to feel defeat. It's time to continue garnering support and fortifying our ranks by inviting more people, more businesses, more elected officials to give people the power to make these choices for themselves. Please continue inviting your friends, your neighbors, your colleagues to voice their support, including access to safe and legal abortions. As supporters of reproductive choice, we are the majority. And it is time for us to own that and stand in our power. Thank you so much for the work that you've been doing for so long. Thank you for pulling in more supporters and for supporting reproductive choice in Indiana. And now it's my pleasure to introduce Jocelyn Cunningham with Blissful Birthing Doula Services.
Hello, good afternoon. My name is Jocelyn. I am a doula and birth worker here in Marion County. I own and operate Blissful Birthing Doula Services, which was founded and started in February of 2020, right before our friend COVID decided to hop into action. I'm here today to speak on behalf not only of women in general, but specifically our Black women who are dying at an astronomically high rate. If you do not know, the data for Indiana is one of the highest in the country, and Black and brown women still continue to die at an average of 3 to 4 times higher than their white counterparts. That is data that is proven, that can be pulled, and that we can talk about all day and all night. What I'm here to speak about is the advocacy to be able to bring the autonomy back and keep it with our communities and with our birthing people who have and need that support. Reducing and eliminating access to abortion is reducing and eliminating access to health care. Abortion is health care. It is a right. It is a right that every single person that is born here in the United States of America is granted the moment they exit the womb. I'm here to speak on behalf of that. I want to thank everyone for participating and coming here today to see and hear our fabulous speakers. These are very important issues as we have opened our legislative session and are ramping up quickly into voting for a new governor and new legislators and representatives. So I hope this here is a priority for everyone involved to give those rights back to the people who deserve those rights. And I personally, as a Black woman born and raised in Indianapolis, who grew up on the Far East Side, it means a lot for me to be able to support my community and advocate for those who may not be able to advocate for themselves. That is what I'm here for today, and I hope every single person in these seats and behind these cameras also stand in that notion here today. This is just the beginning of what we can do. This is just the start of the journey. We do have an uphill battle, but it's not a battle that we have automatically lost. It is people like you, it is voters out in our community, it is people within our legislative, our community-based organizations, our healthcare systems, our doctors, our midwives, our doulas. I am only one integral, very, very, very small piece to this big, big piece of this puzzle. But this is something that we can advocate for, we can fight for. This is something that we should and have to fight for, or we are going to continue to lose lives at a drastically high rate. Because we all know that even if it's not legal here in the state, it is going to happen. And how can we determine that something as safe as abortion can be removed from someone's options? If that is not an option to do it legally, there are going to be people who are going to do it illegally. And what we have to do and come together to deal with and solve and resolve is how we do that safely and how we make sure that the people who need that access are granted that access. Back to what I said earlier, and everyone has reiterated today, it is not an abortion issue, it is a healthcare issue, which is a rights issue. That is what we're speaking on, and that is how we have to view this as a lens. We have to keep our community members, our birthing people, and their families safe, because one parent missing from a household is a very, very big deal for some of our populations and our communities that are already underrepresented, already under-resourced, and don't have
the ability to get access to the healthcare that they need immediately. I'm just up here saying a quick word, say my speech, get that off my heart. I thank everyone for coming out and being a part of this event. It's fantastic, and I hope as we move forward, we continue to ask questions. I am always available for questions. I'm always available to be out in the community. I'm always available to speak. Please, please come up to me and let's exchange contact information. Let's talk to other members of our community and other members who specialize in this type of healthcare to get this healthcare back where it needs to be. Thank you.
Once again, I'm so grateful to be here with all of you in this fight. Every ballot that is included abortion has been victorious. As people across Indiana continue to live through the consequences of these heinous anti-abortion bans, the architects of these cruel laws should hear how it impacts each and every one of us. We are stronger together. We are the majority. We will be heard today, tomorrow, and every day until our basic rights are reserved. Thank you.
Control and abortions play a key role in women's health.
So we know that the people of Indiana want this access, and they're not giving it a chance.
The rally comes after fallout over a controversial ruling by Alabama's Supreme Court. A judge ruled that frozen embryos are entitled to the same legal protections as a child, which could be a problem for families using IVF treatment. Now there's concern lawmakers in other states across the nation may try to follow suit.
States like Alabama and Texas, when they sneeze, the rest of us catch a flu. And so I think we'll see some of the same types of legislation, like fetal personhood, that they are trying to do.
Haley Boer of Indiana for Planned Parenthood believes many people in Indiana would not support that kind of legislation.
But it's a very slippery slope, and that legislation is dangerous. It is harmful to the people of Indiana, and it's not good legislation.
That's why they're speaking up now.
This session and the next session and the one after that will hold them accountable to ensure that we expand access to health care in Indiana.
In hopes that lawmakers in Indiana will keep the rights of women front of mind when considering reproductive laws. Indianapolis Right to Life declined our request for comment. Reporting in Indianapolis, Angelica Robinson, 13 News.